first thing I wanted to ask about, and I see a lot of this, people are wondering about tubal ligation syndrome,
Wondering if it exists or wondering why that happens?
wondering if it exists and wondering, yeah, if that would be a good method of birth control if this is happening so often in people who have that procedure.
Are you talking about people who it failed in, or people who are having difficulty after having it done, like pain and that kind of thing?
Difficulties after, and then people questioning if that would be a good method for them because they hear about those experiences.
I think with that, like with all other things, you really do have to look at the enormity of the information that's out there about it. You know, tubal ligations are performed in a lot of different ways. Long ago, we had a lot of different methods where we had and they still exist today. I know that people still do them, even though it's not the preferred method, but there are like clips or little bands, rubber bands and things like that people would put around the tubes to interrupt them. I don't think those methods are the greatest because there's always a chance of slippage or it falling off or catching on something and causing those kind of discomfort syndromes afterwards. Right now, I believe, and what standard of care is that if somebody wants to have sterilization, they should have their tubes removed, because we know so much now about risk reduction for ovarian cancer that if somebody wants permanent sterilization, if they remove the tubes, they just decrease their chance of ever getting ovarian cancer tremendously, because much ovarian cancer originates in the fallopian tubes. So if you're going to have unusable tubes anyway, and it's not much more of a procedure, which for most places it's not, it's still a laparoscopy where you go in there and, it's a day in, day out procedure, they should be removed. About people who are really, really uncomfortable or having these syndromes where ever since they had a tubal ligation, they're sorry because now they have this endless pain and things. It's a minority of people for sure when you look at the enormity of how many people have had tubal ligations over time. But just like any other surgery, the unfortunate possibility is anytime you do something, surgically, there's always these possibilities of scar tissue, of, damage to other organs in there that wasn't intentional, the way things heal, so I have to say that if somebody's looking at permanent sterilization, the benefit to be gotten from salpingectomy, which is removal of the tubes, is so high that I feel like that outweighs the small possibility that they may have complications and pain and problems afterwards. A lot of tubal ligation issues came out of, and I'm not really going to get into this because this is a huge thing, people who had sterilizations with Essure, which is an in-office procedure where we used to put coils up inside the tubes and the tubes would scar over. This has now become a huge lawsuit against the company. They took it off the market because so many people were uncomfortable afterwards. And I've actually done a lot of legal work at looking at cases where people have claimed, pain and suffering and everything from that procedure. And some of them are really valid. Some of them, it doesn't really seem connected. And since nobody really knows, everybody kind of assumes well, it had to be bad for me if I had it put in and now I don't feel well. It's not always a one-to-one connection. It might be something else, but that's off the market now. So that's not a way that we sterilize anybody anymore. But like I said, I think especially when people have serious medical problems, or it would be dangerous for them to have another pregnancy, the best way to assure that is to go straight for something that's really permanent.
With removing the tubes, is there a general reduction in risk for ovarian cancer, or does that factor in with personal risk? I mean, is there a general risk reduction?
Yeah, it lowers risk of ovarian cancer in anyone who has their tubes removed. And then, of course, whether or not it would be indicated for you to have other procedures done depends on your personal risk. Like if your mother had ovarian cancer, I wouldn't probably stop at the tubes. I'd say when you're done childbearing, take the ovaries out too. but
Okay.
just taking out the tubes lowers the risk. If you have any relative who had ovarian cancer, you are a candidate to BRCA test. I BRCA test every patient who tells me that they have or had a relative with ovarian cancer.
One of my friends told me recently, last year, she went and did I think IVF. She had her tubes tied years ago, and I didn't know.
Factor infertility.
Yeah, I didn't know that you could do that. I thought tubes tied, you're done. And
hey,
here
you got a uterus, you got an incubator, you could use it as long as you don't have to use the pathway to get there, right?
Yeah, I was like mind blown. Like when she told me, I was like, wow, you just don't think about it. You're like, oh, you're not having any more babies. But she's like, no, I went in and they took out the eggs, but I'm having babies. And I was like, wow. So it's not like,
you know where that's kind of common in the scenario where I just said that somebody, let's say, now we're going a little off on a tangent, somebody carries the genetic marker for breast cancer, the BRCA gene. So they get their tubes removed to lower their tubes and ovaries removed at some point. But if, let's say they just had their tubes removed to lessen their future chance of ovarian cancer, but they wanted to have a baby. They have tubal factor infertility. They have no tubes. You can use that uterus. You go through all the regular IVF stuff and you can have a baby that way.
Wow. Science. Yay.
Love it.
That's awesome.